If you're over 60 and taking a cholesterol medication, you need to hear this carefully because one of the most commonly prescribed drugs in the world may be quietly affecting your brain right now, and most people have no idea it's happening, and what I'm about to show you could change the way you look at your medication forever. My name is Dr. Sarah Mitchell, and I'm a cardiologist. For over 20 years I've worked with patients over 60, helping them manage heart disease, cholesterol, and stroke risk. But here's something that concerns me deeply. Many seniors are taking medications that help the heart but may be creating problems somewhere else, especially in the brain. On this channel, my goal is simple: to help you stay healthy, sharp, and independent for as long as possible, not just live longer but live better. And today I'm going to walk you through 7 cholesterol-related medications and situations that could be affecting your brain health after 60, and what you should do instead, because the next one is something I see almost every single day in my clinic. 1. High-dose statins, especially lipophilic statins. Let's start with the most common one: statins. These are medications like atorvastatin, simvastatin, and others. Millions of seniors take them every day to lower cholesterol and prevent heart attacks. And yes, they can be life-saving. But here's what most people don't realize. Not all statins behave the same way in your body. Some statins are lipophilic, meaning they can cross into the brain more easily, and when they do, they may interfere with something very important: cholesterol in the brain. Now this might surprise you, but your brain actually needs cholesterol. It's essential for memory formation, nerve communication, protecting brain cells. When certain statins reduce cholesterol too aggressively in the brain, it may lead to symptoms like brain fog, memory lapses, confusion. I've had patients come in and say, "Doctor, I feel like I'm not as sharp as I used to be. I forget simple things," and sometimes the only thing we changed was adjusting their statin dose or switching the type. A study published in medical literature has shown that some patients on high-dose statins reported cognitive side effects, especially older adults. Now this doesn't happen to everyone, but here's where most people make a mistake. They assume that more is always better when it comes to lowering cholesterol. That's not always true, especially after 60. What should you do instead? Ask your doctor if you're on a high dose. Discuss whether a lower dose could still protect your heart. Ask about hydrophilic statins, which are less likely to enter the brain. Sometimes a small adjustment can make a big difference. And the next one is even more dangerous because it doesn't come from a prescription bottle. 2. Over-aggressive cholesterol targets. This one surprises almost everyone. It's not just the drug. It's how low your cholesterol is being pushed. Many seniors are told, the lower your cholesterol, the better. But after 60, that idea needs to be handled carefully because extremely low cholesterol levels have been linked in some studies to memory problems, mood changes, even increased risk of certain neurological issues. Why does this happen? Again, your brain depends on cholesterol. It uses it to build connections between cells. When levels drop too low, those connections may not work as efficiently. I once had a patient in his early 70s, very disciplined, followed every instruction perfectly. His cholesterol numbers were ideal on paper, but he started experiencing trouble concentrating, mild confusion, low energy. When we reviewed his labs, his cholesterol was extremely low. After carefully adjusting his target range, his symptoms improved. Now listen carefully. This doesn't mean high cholesterol is safe, but it does mean that balance matters, especially for seniors. What should you do instead? Ask your doctor what your target cholesterol range is. Make sure it's appropriate for your age and overall health. Focus on personalized goals, not just as low as possible, because the next item is something many seniors take thinking it's natural and safe, but it may be quietly affecting the brain in a different way. 3. Certain cholesterol-lowering supplements. Now let's talk about something over-the-counter supplements, things like red yeast rice, high-dose niacin, uncertain herbal blends. These are often marketed as natural cholesterol solutions, and many seniors prefer them because they want to avoid prescription drugs. But here's the problem. Natural does not always mean safe. Some of these supplements can act like statins in the body, interfere with liver function, affect blood flow and brain chemistry. Red yeast rice, for example, actually contains compounds similar to statins, but the dosage is often unregulated, which means you could be taking too little, ineffective, or too much, risky, without even knowing it. And high-dose niacin, while it can affect cholesterol, it may also lead to flushing, dizziness, and in some cases, neurological discomfort. This is where most people make a mistake. They assume supplements are automatically safer because they don't require a prescription, but your brain doesn't care. Whether something is natural or not, it only responds to how it affects your body. What should you do instead? Always tell your doctor about any supplements you take. Avoid combining supplements with statins without guidance. Choose evidence-based treatments when possible. And now, the next one is something I see far too often, and it could be silently increasing your risk without you realizing it. And what I'm about to share next is something many people never connect to their medication at all, yet it can have a direct impact on your brain. For drug interactions with cholesterol medications, this is a big one, because after 60, most people are not taking just one medication. They're taking several: blood pressure pills, diabetes medications, sleep aids, pain relievers, and here's the danger. When cholesterol medications, especially statins, are combined with certain other drugs, they can interact in ways that affect the brain. These interactions may increase drug levels in your body, slow down how medications are cleared, affect the nervous system, leading to symptoms like drowsiness, confusion, memory issues, slower thinking. I remember a patient in her late 60s. She came in with her daughter, who said, "My mother just isn't herself anymore. She was more forgetful, less alert, sometimes confused." At first, it looked like early cognitive decline, but when we reviewed her medications, we found something important. She had recently been prescribed a new drug that interacted with her statin. Once we adjusted her medications carefully, within weeks her clarity improved. This is where most people make a mistake. They assume each medication works on its own, but in reality your body processes everything together, and after 60 your metabolism slows down, which means drug interactions can hit harder and last longer. What should you do instead? Ask your doctor or pharmacist for a full medication review. Check for interactions, especially when starting something new. Never ignore new symptoms after adding a medication, because sometimes it's not aging, it's the combination. And the next one is even more subtle because it builds up slowly over time. 5. Long-term use without reevaluation. Here's something I see all the time. A patient is prescribed a cholesterol drug in their 50s, and then continues taking the same dose for 10, 15, even 20 years, with little or no reevaluation. But your body at 70 is not the same as your body at 50. Your metabolism changes, liver function may slow, brain sensitivity increases, which means the same medication at the same dose may affect you very differently now. Over time, this can lead to subtle changes like mild memory decline, fatigue, reduced mental sharpness, and because these changes are gradual, most people don't connect them to the medication. They just think, well, I'm getting older. I had a patient who had been on the same statin dose for nearly 18 years. He started noticing brain fog, nothing dramatic, just not feeling as clear as before. We reassessed his need, adjusted his dose, and focused more on lifestyle support, and over time, he felt sharper again. Now listen carefully. This doesn't mean you should stop your medication, but it does mean you should not be on autopilot. What should you do instead? Review your medications at least once a year. Ask, do I still need this dose? Discuss whether adjustments are appropriate, because your treatment plan should evolve as you age. And the next one. This is something many people completely overlook, yet it directly affects how your brain functions every day. 6. Ignoring side effects early on. This one is simple, but very important. Many seniors notice small changes after starting a medication, but they ignore them. Things like mild forgetfulness, trouble focusing, feeling off mentally. They think, it's probably nothing, it will go away. But sometimes, those early signs are your body trying to tell you something. Your brain is incredibly sensitive. Even small chemical changes can affect how you think and feel, and when side effects are ignored, they can gradually worsen. I've had patients say, I noticed this months ago, but I didn't want to bother anyone. But by the time they speak up, the issue has already progressed. This is where most people make a mistake. They wait too long, or they assume the symptom is just part of aging. But not every change is normal, and not every symptom should be ignored. What should you do instead? Pay attention to new mental or memory changes. Keep a simple symptom journal. Report changes early to your doctor, because catching something early can prevent bigger problems later. And now, the final item is one of the most overlooked of all, yet it may be the most important for protecting your brain long term. And this last one is something I wish every patient understood earlier, because it doesn't come in a pill bottle, but it determines how well your brain and heart work together. 7. Relying only on medication, ignoring lifestyle. Here's the truth. Cholesterol medication can help reduce risk, but it does not replace the foundation of your health, and that foundation is your daily lifestyle. After 60, your brain becomes more sensitive too. Blood flow changes, inflammation, blood sugar levels, physical inactivity if you rely only on medication. But ignore these factors. You may still experience brain fog. Memory decline, reduced mental clarity even if your cholesterol numbers look good. I had a patient who proudly told me, "My cholesterol is perfect, doctor." But when we talked further, he wasn't moving much, his diet was highly processed, sleep was inconsistent, and mentally, he didn't feel sharp because numbers alone don't tell the whole story. Your brain needs oxygen from movement, nutrients from real food, rest from quality sleep. Without these, no medication can fully protect you. This is where most people make a mistake. They think the pill is the solution, but the pill is just one part of a much bigger picture. What should you do instead? Focus on simple, consistent habits. Walk at least 20–30 minutes daily. Eat more whole foods, vegetables, healthy fats, lean proteins. Stay mentally active, reading, conversations, learning. Prioritize 7–8 hours of sleep. These changes support both your heart and your brain together. And now, let's bring everything together into clear, practical steps you can follow starting today. If you're over 60 and taking a cholesterol medication, here's what I recommend. 1. Review your medication. Ask your doctor, what type of statin am I on? Is this the right dose for my age? 2. Check your cholesterol targets. Make sure your levels are not being pushed too low for your individual needs. 3. Evaluate supplements. Tell your doctor about anything you're taking, even if it's natural. 4. Look for interactions, especially if you're on multiple medications. 5. Reassess regularly. Don't stay on the same plan for years without review. 6. Monitor your mind. Pay attention to memory, focus, and clarity. 7. Strengthen your lifestyle. Support your brain daily with movement, food, and rest. Now, I want to be very clear about something. Do not stop taking your cholesterol medication without speaking to your doctor first. These medications can be life-saving. Stopping suddenly can increase your risk of heart attack or stroke. The goal is not fear. The goal is awareness and making smarter, safer decisions with the guidance of your healthcare provider. If you're over 60, I'd like to ask you something. Have you ever noticed changes in your memory or focus after starting a medication? Let me know in the comments below. I read every single one, and if you found this helpful, subscribe to the channel because I share simple, medically accurate advice to help you stay healthy, sharp, and independent as you age. And in the next video, I'm going to show you 5 common healthy foods that may actually be increasing inflammation in seniors without them realizing it. You won't want to miss that. Stay informed, stay sharp, and take care of both your heart and your brain.